Welcome back. Still the breakfast on Plus TV Africa. We're set for our first major conversation this morning. And let's quickly inform you, the president of the Nigeria Academy of Pharmacy, Prince Julius Adelusi Adeluyi, has called for the producing of active pharmaceutical ingredients for drug manufacturing to ensure medicine security. Stated this at the investiture of new fellows into the academy yesterday in Lagos. Now, he noted that the issue of how well Nigeria has strived to imbibe the lessons of COVID-19 pandemic, saying this is worth examining because, among several others, a core lesson which the pandemic teaches us is the imperative of medicine security, particularly as it relates to local manufacturing of medicines. According to him, a country with the hydrocarbon resources that Nigeria boasts of must commit to producing API for drug manufacturing rather than relying endlessly on importing these same raw materials. Now, why isn't this already happening, and how feasible is it? Dr. Tuyi Mebawondu is a public health expert. He joins us live in the studio to look at this. Dr. Mebawondu, good morning to you. Thank you very much for your time.
Yeah, good morning, Kofi.
All right.
How was your weekend?
Fantastic. Great to have you here.
Yeah.
All right. When you hear the pharmaceutical professionals saying something like this, what goes through your mind? They really saying what is possible to be done as far as manufacturing of drugs in a country is concerned, getting these APIs locally?
Now, I think the first thing is to clarify, what API is. In drugs, there are actually two components: the active pharmaceutical ingredient and the excipients. The excipients are just like medium to put the drug into and carry it. It can be starch, lactose, oil, and that's what you see, those capsules, and then the tablet. That's why the tablet is that big. The active ingredients are actually what is working in the drug. So if you say ampiclos now, you are talking about ampicillin, clozacillin as the active ingredient. So the active pharmaceutical ingredient is the core of all the drug manufacturing. Now, you look at Nigeria, we have between maybe 115 to less than 130 pharmaceutical manufacturing concerns. That's all you have in Nigeria, of a country of 20 or something million. But interestingly, Nigeria's capacity or even ability to produce active pharmaceutical ingredients is compromised. So what you see that most of those pharmaceutical companies actually have to import, mainly from India and China, those active pharmaceutical ingredients, which they then now compound there, and like put it to a finishing product to be sold to us. Now, what are the lessons? First and foremost, COVID came. The COVID put the whole supply chain of drugs into a real quandary because factories were closing down in India and in China. Movement was restricted. You have now to rely either on your local production or handouts from so-called developed countries to get a lot of essential drugs. And even then, we saw the cost of drugs growing up. It became quite expensive to get drugs. So ordinary syringe and needles went from about 1,000 naira to 5,000 a pack. So that became a real problem. Now, the challenges of the future for any country is to see that you have what they call health security. Health security is not just about the doctors and nurses alone. Your ability to manufacture and provide drugs and medical essentials for your population becomes very key. And then you hear that a place like US telling you that they have this social number of face masks in stock. They have social number. And then when you look at our disease pattern, quite a lot of common diseases that we're not manufacturing the drugs. Even the research on those things are not happening. Now, the point of manufacturing drugs or manufacturing active pharmaceutical ingredients start from research. You need the quality people that need to do research and then go ahead and figure out this and this will become this. The second point is actually, because it's a very, very skill-intensive process. You need machines. The machineries are not just you fabricate somewhere in Alaba. It has to be a precise machine because you want to ensure the consistency of the product and you want to prevent contamination. These are very key. But those are the industries, the high-end industries, actually in health, that we are not looking up to, that we're not doing. Instead, we're comfortable with importing those active pharmaceutical ingredients and then compound it and start wasting foreign exchange. And now we're in dire straits, no foreign exchange, we're not manufacturing, we still have to import. So how do we navigate this?
No, okay, so before we get to the question of how we navigate that, there's also another concern about the cost of producing. You have manufacturers complaining about, the high cost of producing this, and then they say that it's a lot on them. And some people have complained that they might probably just be out of business because the percentage is actually about 300%, and that's on the high. It's also the issue of forex, like you have mentioned, as one of it, amongst other issues, power failure, what have you.
Yes, you know what? There are basic infrastructure that will help industrialization. Of course, your road network, your power supply, your tax regime. Tax is very crippling, even on an essential, because everybody just want to. It's like a racket. You pay this tax, pay that, local government, under government, touts, everything. And then when you are moving the drugs around the country, because you need a logistic system to move those your active around the country, you see all sorts of characters blocking the road, demanding for this, demanding for that. And then access to finance has been quite challenging because the country itself is facing some financial crunch. Even when they were not facing financial crunch, they prefer to pick from outside. So access to finance, regulation, and indeed, even if you want to do that, you see the cheaper version coming from India and China. And then people would rather prefer to get the cheaper version from China than to actually work here. So government must find a way to protect this and stimulate that aspect, because that, apart from creating jobs, is a high-end, essential industry that must not be neglected.
Interesting. You've talked about how important such an industry is. Messi mentioned foreign exchange. I'm sure if you go through the books to see how much the Indians are earning from drug manufacturing, it'll be a lot. It'll really be a lot, and that could really turn economies around. Let's look at the pharmacists themselves, because this is the Nigerian Academy of Pharmacy, through its president, saying this. I mean, what stops the pharmacists themselves from, at least, you have to push yourself. You have to try and make an effort. You look at what the likes of, I'll mention the names of the big pharma. We know who big pharma are, in terms of how they push themselves to come up with vaccines against COVID-19, and how much they've made tons of cash, billions, to the extent that, billionaires had to invest in these companies. And then there were conspiracy theories about how they were, pushing COVID-19 and all that so they could sell more vaccines. But where does the responsibility fall, or at what point should the pharmacists take responsibility? Sir, doctor, why I'm asking this is, the average pharmacist that I know, I'm not an expert, you're an expert, you tell me if this is true or not, but the view out there is that people go to school, study pharmacy, and when they come out, they want to open a drugstore, a pharmacy to be dispensing drugs, and that is it.
There are many aspects of pharmacy, from pharmaceutics to pharmacognosy, and also this, clinical pharmacy. There are many aspects. There are manufacturers, that actually the pharmacists that are trained to run the manufacturing sector of the pharmacy. Why you are not seeing a lot of them going into that is simply because there are actually no factories and the environment is not conducive to set up one. Otherwise, what else do you expect them to do? But you see some flickers when some agencies are manufacturing their own drugs. If you look at the Nigerian medical services now, they manufacture some basic drugs, try to do paracetamol, try to do this, try to do that. And, and they are putting that in the market. And then you see some universities trying to do some manufacturing in a way. I think the challenge is for government to link those institutions to regularly organized industry, so that they can then be able to produce for the country. But we have abundance of those raw materials used in active pharmaceutical ingredients. A lot of them are petrochemicals, a lot of them are just natural products like cassava and starch. We have a lot of them. It will amaze you that we choose to export cassava, for instance, to China, where it is used to make the kind of lactose or fructose or starch that is used to as excipients for those drugs. So now, even to the ability to actually make those starch available, the final product in Nigeria, is difficult. You have to export the cassava for them to process it into that. So we should be looking at the depth of actually what we're doing. Scaling up is just, okay, India is doing like 45% of the whole drug manufacturing worldwide. India is, so if India shuts down today, you're going to have problem in America, you're going to have problem in quite a lot of countries, including Africa. So what has India, how has India been able to scale that and then get to the level where they are in? It's a deliberate investment in science education, a deliberate investment in those kind of industry that will give them advantage. Is it not right time that we should also be doing such thing? Because we are talking to African free trade agreements, whereby we're supposed to be manufacturing for the rest of Africa. But here we are, we're just stuck. We're not even doing anything. We cannot even manufacture active pharmaceutical ingredients. The excipients that are being used, we cannot put any of them together.
So let's begin to look at the solutions, because we're coasting out of. We're getting. We need to move on, and we're out of time. Solutions, long-term solutions, short-term solutions.
Well, the starting point is actually one: improve knowledge, training in that regards. If you have such a large number of pharmaceutical manufacturers, in the sense that people that specialize in manufacturing of drugs, you are happy. Okay, that's the first thing. Secondly, you have to move to the industry. There has to be a deliberate stimulation of that industry, because if you are short in anti-malaria, for instance, you are running into trouble. Okay, how long can you import? You must be able to secure yourself against that future. So, training, knowledge, finance, deliberate support for those industries, and using extant laws to help them, stimulate that. We need to have conversation on the health, quite a lot of aspects of health, from human resources to health, and even the availability of those drugs, because they are actually very expensive. You must be able to find a way, because if you look at the disposable income in Nigeria, people they have to need to buy antibiotics, and they have to spend such amount of money on antibiotics. It's not healthy for them, and because when those things are in short supply, fake will come in, adulteration will come in. It will be a big problem for the health system. So the government needs to, make deliberate efforts in terms of finance, training, and support for such industry, because indeed that is where, even if after a doctor might have made his diagnosis and all that stuff, you don't have drug to give, then you've not done anything. You've not done anything. So drugs and laboratories are very essential part of the health system.
Indeed. Data available to me shows that the Germans are on top when it comes to pharmaceutical manufacturing. They make, on an average every year, talking about $91 billion. The Swiss make $86 billion. The Americans are third. They make $57 billion every year. The Irish, surprisingly, are fourth. Yeah. They make $55 billion. And most of these countries don't have these raw materials you're saying. It's quite sad. Messi,
And then that's the key issue, because they use the raw material they get from here to do all those things. And then there are two issues that is, that are very important in this discussion. You are seeing evolution of diseases and demographic changes. Okay, we're not having COVID-19 until it came, right? Now there are diseases that requires new drugs, and your research must be able to reach those ones. Okay, and then drugs are being made smarter now. It's not that you swallow drug and then the drug just go around your system and cause side effects. We are at the level of intelligent drug designs now. So, but we have not even started with the common one. So it becomes important that our research must be able to match the demographic evolution, disease evolution, smartness of the drug. It must be able to match all those ones. If you don't have that stream, then we're not ready.
But
the top 30 countries, and I'm not even seeing India part of the top 30 countries in the world, which is quite surprising. But before Messi, sorry, before you come in, I'd like you to speak talk about because I mentioned earlier, but we didn't go into detail. Private sector, if this is an opportunity for investment to make huge returns, look at the amounts I'm mentioning here. Even just to get maybe, look at the population of Nigeria, just get a little percentage of that global market. It's a lot of money.
Even let's talk about local markets. Yeah. Before you are talking about global, talk about your local market. You have 200 million people that need drug every day. Messi actually alluded to that when he said it's because the challenge is this: infrastructure, cost of money, support system from government. These are key because a private sector person will not want to then get involved in manufacturing and be losing money. On the other hand, to manufacture that drug in India may just be very small because that's generic. It's just small amount of money. By the time you get to Nigeria, it's times 400. And then you wonder, somebody would not import the drug, to come and kill your own manufacturing. So it's a critical policy issue that we need to address. Talking
about policy issue, Mebawondu, I'm very, very concerned. And I'm asking, is it that we don't understand policymakers, policy influencers, those are the hem of affairs, don't understand, the sensitivity or the fact that it's very critical, to the economic development, because we're talking about a healthy nation here, availability of these drugs. You can't wake up and say you have a country without that. So what exactly is the issue? I mean, is it that we don't understand how critical this is? How important this is, how sensitive, how expensive, that we can allow that to the hands of, the private sector, and that the government should make this as a priority?
We understand that. If we never understood it, you won't be seeing the president of pharmaceutical manufacturer talking about it. We've been talking about this, we understand. But there's always this disjointed connection between the government, governed, and policies, What we see especially in Nigeria, because if you want to interrogate the challenges of Nigeria or Africa, for instance, for me, it boils down to one basic depth of thinking and ability to follow up in that thinking. We think at the level of our belly and sex organs, that's all. We just want to satisfy our belly and sex organs. Compassion is absent from us because you look at it, you think either from your head or from your heart or from your belly. Those are the three levels of thinking now. We're trying to go to deep things. So in reality, I'm supposed to push the police. They think that, what is in it for me? WIIFM, that's the radio station they are listening to. What is in it for me? So what they want to do is to see that, again, what can I get from this? Instead of them to push a policy that will be compassionate and reach out to the least in the society, they want to say, once I can get money, let them the rest. I'll go and buy a house somewhere. I'll say I'll put one around my house. If I'm sick, I'll fly to this country. Yes. So as long as you see that kind of disconnect, people attached to their belly and their sex organ to satisfy without heart and compassion, you will see this thing every time. You can do all the policy you like. If you cannot think from your heart where Christ lives, where you have compassion and understand and look at why am I stealing something billion naira? To do what? If not to satisfy my belly and sex organ.
Yeah, doc,
so these are the challenges we have. So just we can elevate. Okay.
Your federal government, the president announced sometime in August that the federal government had disbursed about 100 billion, a total of 100 billion naira to indigenous drug manufacturers. I'm sure they should be welcome in this regard. Maybe the Pharmaceutical Academy, they're not aware. A total of $100 billion indigenous pharmaceutical manufacturers and healthcare experts, or healthcare investors rather, as loans to expand their capital base and boost local production of medicines and medical consumables. So maybe the Pharmaceutical Academy's president is not aware that the government has been doing.
Why won't they be aware? Go and search the criteria for those awards, and look at the metrics. You'll be surprised at the end of the day that we're still dealing with belly and sex organ. Because you see, there must be a tandem, there must be a sync between training of experts, okay, university funding, okay, then market production, which is the factory, and infrastructure. Do you understand? If you choose to put, or I don't care, whatever money, into a violent environment where manufacturing is not encouraged, where you have not protected those people manufacturing the drugs, you know, where you have not even nationalized the concept of which drug must we import every drug. We're not talking about cancer drugs, those ones are really high drugs. We're talking about basic drugs. We're talking about active pharmaceutical ingredients.
All right. Well, we have to leave it at that. But the central bank has been disbursing these loans, you know, through what they call its support initiative for the private pharmaceutical sector. They even have a committee called Health Sector Reform Committee, chaired by the VP. Let's see if that will yield any result. Dr. Tuyi Mebawondu, thank you very much for your time.
Thank you. We'll see the reform. I'm sure you are seeing the reform. Go and look at the data. Then you know that nothing is being reformed.
All right. We'll be right back. Up next, we discuss the federal government approving a disbursement of $350 million in cabotage funds, and we'll look at the impact on the shipping industry when we return.